Okay, so welcome to our diagnosis course on the DSM, and today we're going to be talking about oppositional defiant disorder and conduct disorder and a few other things as well. And I think we should talk about these topics whether you're in school counseling or clinical mental health. I think it's important to put them in a context of both a school setting, until they graduate or drop out or whatever, and how one might handle that, but also in a clinical mental health setting, moving from one diagnosis to another, and moving from a younger age to a later age, and what these things might look like. The reason I'm saying this, I've worked in both schools and clinical mental health settings, and these are difficult diagnoses to treat, but I also think that there is a lot of potential, positive potential, in individuals who have these diagnoses. In most cases, there is an environmental reason for these diagnoses. Yes, some individuals might have some genetic component or physical component to this, but I've found that environment plays a major role in most of these cases, and as a result, I think we could see a lot of progress, especially if we intervene in a positive way at a very early stage. The earlier, the better. Most of these individuals do not want to see a counselor or a school counselor or a therapist. Most of them will most likely be resistant to counseling. They will not want to be there, and many times they might be court mandated or at least mandated by school authorities like a principal or vice principal or something like that, or sent by a teacher. Sometimes it's by a parent or guardian. In most cases, the individuals dealing with oppositional defiant disorder is seen as the identified client. Personally, from my own experience, yes, a lot of times they are the ones acting out. However, in so many cases, I see it more as a systems problem. And by that I mean it's a problem with a family system. It's a problem with a school system. It's a problem with some family, peer group, organization, school, some system or combination of systems that leads to some of these early problems, and then if not treated, then it leads to a much more profound problem. So you can follow along on the screen. I have the notes up on the screen. I would also say that at least for oppositional defiant disorder, that as we look at the criteria in A, a lot of it, I think, relies on the severity of the symptom or criteria. So, for instance, if you just look at, a pattern of angry, irritable mood, argumentative, defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by at least 4 symptoms from any of the following categories and exhibited during interaction with at least one individual who's not a sibling. Angry, irritable mood, often loses temper, is often touchy or easily annoyed, is often angry or resentful. Argumentative, defiant behavior, often argues with authority figures or, for children and adolescents, with adults. Often actively defies or refuses to comply with requests from authority figures or with rules. Often deliberately annoys others. Often blames others for his or her mistakes or behavior. Vindictiveness, has been spiteful or vindictive at least twice within the last 6 months. And here we have criteria B, disturbance in behavior is associated with distress in the individual or in others or in his or her immediate social context, family, peer group, school setting, or it impacts negatively on social, educational, occupational, or other important areas of functioning. Criteria C. The behaviors do not occur exclusively during the course of a psychotic, substance, depressive, or bipolar. So we're just ruling out other things in criteria C. Here we do have the severity. Mild symptoms are confined to only one setting, home, school, peers. They are usually not. Moderate symptoms are present in at least 2 settings. That's usually the case. Or severe in all 3 settings. Peers is rare. They usually feel understood by their peers, unless they're isolated. Associated features, problems in family system. ADHD is also common. Higher degree in parents with a diagnosis themselves. So if we look at these first 2 categories, angry or irritable mood or argumentative and defiant behavior, that's almost every teenager I've ever met, including myself. So, come on. That's why I think severity is such an important aspect of the diagnosis. And not severity that they specify down here below. Severity in that, how serious is this when it occurs? When someone loses their temper, what's the degree to which this is displayed? Is somebody throwing a desk or books or, how are they acting out? How severe is this? Touchy or easily annoyed? I don't know. That's most people I know at some point. If they're having a bad day, a bad week, a stressful situation, a problem at home, is often angry or resentful. Well, that goes along with temper, Argumentative or defiant. Well, it kind of leads into that. If somebody's having a problem in a system, whether it's a problem with a family system or a system in the school or classroom or something like that, vindictiveness adds a little different twist to this. Spitefulness and vindictiveness does, in my opinion, add a little more seriousness to this. But it's only twice within the past 6 months. So, personally, as a therapist, I do want to ask, how is this affecting the individual who is displaying these symptoms, or how is it affecting the system or environment in which these things are occurring? How disruptive is this to a classroom or to a family at dinner? How much stress or impact is this creating? I know it's difficult to deal with individuals moving through these criteria, but I don't know whether I would really diagnose a young teenager, 13 or 14, who is, being a little disruptive at home and testing their limits and wanting to do some things that the parent or guardian doesn't want them to do, or maybe they're having a personality conflict with a teacher at school. That might not always be the student's fault. If they're having a personality conflict with a teacher at school, I always ask myself, wonder whose personality is the problem here. Just because someone is in a position of authority doesn't mean they can't handle a situation a little better as well. So it's important not to just see the person sitting in your office as the designated client. What else is going on in these systems? Yes, I'm sure teenager should be able to handle a situation better if they choose to. Yes, they should not have acted out in class or said what they said to a teacher or a parent or a guardian. Yeah, we know that. But we're therapists, we're calm, we're adults. They need to figure this out, and we can help them with that. Some cases are more serious than others, and the second thing I ask myself is, okay, so the first thing, how is this impacting the individual's welfare and the welfare of the system in which it's occurring, or systems? Second thing I ask myself is, can I foresee this getting more serious? Will the actions and irritability and defiant behavior progress in a negative way and get more serious? Will it lead to legal problems, expulsion? Is it already doing those things? Or is it a phase that they're going through? Or is it a result of a specific situation? If the situation changes, will their but irritability and defiance change as well? Is it a family systems problem where I need to talk with everybody, not this one individual? Is it a problem with the system in a school? Do I need to meet with the teacher and principal as well? Sometimes schools can be extremely authoritative. It's their way or the highway, and that doesn't work for everybody. So, who do I need to work with? Is it really just this one individual? Or, as I found so many times as a school counselor or a clinical mental health counselor, I get a client who is going through some of these things. Yes, easily diagnosed as an oppositional defiant disorder. that will always be on their record. But I need to do a little detective work. I need to do comprehensive assessment. Teachers don't always realize what a child or student is going through and experiencing in their life. They might be experiencing extreme stress as a result of poverty, homelessness, divorce, separation, grief and loss, uncertainty, hunger. It's pretty hard to be happy and attentive if you're starving. Bullying, 1,000 different possibilities. So, how do we figure this out? By the time I got a young person, sent to me, they don't want to be sitting with me, they don't want to tell me their life story, but I need to build trust with them. And so I try not to be seen as an authoritative figure. I'm not going to get them into any trouble, although I do have to tell them about the limits of confidentiality. In addition to that, there are many ways I can build trust with them. I can tell them that, this is not a normal meeting with an adult. I would like to hear their side of the story, and that doesn't mean blaming, but I want to understand what is going into this anger or defiance. Those are secondary emotions. A lot of times I might even see them in what's called an anger control group. And they want me to teach them how to control their anger. Well, I can do that, but that's really just a Band-Aid. I really want to figure out what is causing this anger. What feelings are they experiencing? What environmental factors are they enduring that results in anger? And if they deal too much with this, they might begin to self-medicate. And then we're into drug use for escapism or to numb the feelings of anger or the feelings beneath that anger. Hopelessness, betrayal, worry, anxiety, depression, hunger, whatever. Sense of unfairness or being misunderstood. So I might say simple things like, I wonder if you're feeling misunderstood by all of these other adults. Help me to better understand you so that I can help you. I might want to align myself with the student in that, hey, I know you don't want punishment. I know you don't want to be in the principal's office. I know you don't want to be here. There are certain simple things that you can do that I can help you with. People will leave you alone. Very simple things that can help you avoid adults yelling at you, giving you consequences, so that you can make it through a day a little more easily. So aligning myself with the client. That doesn't mean I'm saying that what they're doing is right. It's not what I'm saying. But I can understand that they don't want to be dealing with adults yelling at them or being punished or expelled or suspended or whatever, it's a lot of stress that they don't want to deal with. So let's figure out a way to avoid that. You know? So a lot of times I'll use an example of, speeding and police officers. And most people have not noticed their speed in a car, and they've gone too fast, and a police officer stops them. Well, an individual experiencing some oppositional defiance may get an attitude with that police officer. They don't feel as though they should have to deal with that. They have a lot of other stressors in their life, either with a family system, school system, both. And they become defiant in the way they approach that situation. Well, I ask them, what's the result going to be? What would you say if you were stopped? What do you think would happen as a result of that? Well, they get a ticket. Okay, then the police officer wins. Well, I tell them, I'm not perfect. I've been stopped. However, I remain calm. I apologize for speeding. I say I didn't realize it, but I'm very sorry. I usually try to do my best to follow the speed limit and all the laws of the road driving. And then I say, I always call them officers, ma'am, sir, whatever. Very respectful. And before they go back to their car, I say, I would really appreciate it, even though I was the one who made the mistake, if you could find any way to help me, maybe not get some points so I don't have to pay more on my insurance. My budget is really tight right now, and I'm struggling a little bit financially. Just appreciate any help you could give me. So I ask them to help me in a kind, respectful way. So they come back and they give me a warning, or they give me a fine but no points on my license. Who's the winner? Well, I'm the winner. But also, the police officer's the winner. It is a mutual win-win situation. So we talk about win-lose, lose-win, win-win. Did it hurt me in any way to be kind and respectful? No, it didn't hurt me at all. In fact, it helped me quite a bit. That's just a common example of many that illustrates how their lives might be a little easier, and it's not hurting them at all. But because of the underlying feelings resulting from some negative experience in their environment, those feelings of unfairness or betrayal or impoverishment or whatever, being unloved or unaccepted, being yelled at constantly, I don't know, whatever it is, result in anger. And once things result in anger, it's hard, very difficult to put ourselves in that state of mind where we can be calm, collected, polite, think about the bigger picture, what we want out of that situation, even if we're wrong. So the next step is to build trust with that individual. And I simply ask them about their life. I might start off with, what do they like in music? Maybe they like Kurt Cobain and Nirvana, and so I wouldn't understand that because I'm an old man. But I might say, so Kurt Cobain, you know what year he was born? 1967, same year I was born. So if he had lived, if he had survived, if he had dealt with his own emotional issues, then he'd be the same age as me right now. But trying to connect on some level. Maybe they play music. Maybe they're like sports. Maybe whatever they like. There's some way to connect. Maybe they're isolated. Well, then I can be a person they talk with. I'm not going to judge them. I might judge their activities, work with them on that, but I'm not going to judge them as a human being. So building a level of trust so that eventually they feel comfortable enough to disclose what the underlying emotions and issues really are. Well, what's going on at home? What's going on in school? And they tell me. And that's something we can really deal with. Hopefully. Sometimes it's beyond our control, and then maybe this is the safe place for them. Maybe school can be their safe place. I don't know, but there's got to be some way to help them. Even if it's saying, okay, I'm going to help you get through the last 2 years of high school so you don't have to drop out. And then you can move out of your parents' house. You don't have to deal with that negative situation anymore. And I can help you get into some training program or something more positive. So, making that connection, looking at the underlying issue and trying to find some small way. And if you do that, then you're at least one person in their life who cares, rather than them feeling totally isolated and alone. Sometimes one person in somebody's life makes a world of difference. So, usually what happens is if this is only, if oppositional defiance is only addressed in negative ways or with punishment, then it becomes more severe and leads to a conduct disorder. I think the only other thing I'd like to say is that often it says that ADHD can lead to this. I think that's because it has to deal with impulse control and punishment instead of teaching people how to deal with impulses and to reinforce positive things. But I would also say that many times reactive attachment disorder can be involved in oppositional defiance. But all of these things can eventually lead to conduct disorders. So here we have repetitive and persistent pattern of behavior in which the basic rights of others and major age-appropriate societal norms or rules are violated. Presence of 3 or more of the following criteria in the past 12 months, with at least one criterion present the last 6 months. Aggression to people and animals. Destruction of property, deceitfulness or theft. Serious violation of rules. Disturbance in behavior causes clinically significant impairment in social, academic, or occupational functioning. So here we have a much more severe type. And if the individual is age 18 or older, criteria are not met for antisocial personality disorder. So there's usually more involvement from authorities with this, whether it be school authorities, CYS, or legal problems. Here we have different times of onset. The earlier the onset, the more important it is to intervene at an earlier age. Childhood onset prior to the age of 10. There's usually some type of abuse involved in this, although that's not always the case. Adolescent onset, absence of any criteria prior to 10. Unspecified onset, age of onset is unknown. Here we have severity. Associated features, individuals may show a lack of empathy or guilt. If this is the case, this could also involve reactive attachment disorder. It could involve or lead to borderline personality disorder. Empathy or guilt is so important, and we'll talk more about that when we talk about reactive attachment disorder and borderline personality disorder. They may misperceive the intentions of others, see it as more aggressive than it really is, may have low self-esteem or self-efficacy, may be early onset of sexual behavior, drinking, drugs, usually involved in that. There's a higher degree of suicidal ideation because beneath this behavior is usually some type of serious negative criticism, self-criticism, low self-esteem. They've heard negative things about themselves on an ongoing basis. Higher degree of suicidal ideation. ADHD is more common. Runs in families, most likely because of multi-generational family systems. It is passed on not only genetically but through family environments that become extremely negative and hurtful. Youths often have first-degree relatives with histories of this conduct disorder. So usually have temperamental characteristics that contribute to this, more common in males. Heredity, genetic and environmental factors. It's fairly prevalent, 5% to 10%. That's pretty high. But let's just talk about this just a little more. I think that one of the things that contributes this is the absence of truly caring individuals. People who care enough to intervene on an impactful level to actually help make some real changes in these individuals' lives. Just knowing that one person truly cares can make all the difference in the world. And I think on a professional level, with appropriate boundaries, a therapist can be that person that they build trust with, that can help them to regulate themselves emotionally and see themselves as a person with some real positive potential. We can talk about how they can get out of the system that they're in that may be impacting them negatively. And even though it may take time because they're not 18, maybe they are 18, we can create a plan where they are successful and they can become independent people. But we also talk about things like, do you want to continue this system in your future lives? Do you want to be a negative parent or guardian that you've experienced with your own kids? How can you break this cycle? How can you find your own internal peace? How can you avoid authority figures in your life? That's usually what they want. And I think all of those things are possible. But it's important to address them directly. A lot of people have very specific cognitive interventions, but I use them, but more as techniques like irrational thought processes, negative self-talk, positive self-talk. I usually talk about these things on a heart-to-heart level. What's really going on here? What can we do to make some real change in your life so that your day is positive or at least peaceful, so that the inner turmoil is peaceful? What can calm that storm inside your mind? That's what I see the purpose of therapy being with, individuals who suffer from these disorders. All right. Have a great day.